Every jurisdiction in Maryland has a health improvement coalition. We're unique in the Mid-Shore in that all 5 of our counties, Caroline, Dorchester, Kent, Queen Anne's, and Talbot, decided to work together. So the coalition is led by the 5 health officers of each of our 5 health departments, but it expands well beyond local public health. And we're looking at needs that we have in the Mid-Shore, and there are many. So certainly we're not alone with looking at diabetes, cancer, tobacco use, but we have a lot of other needs that are driving those. Not having enough providers to see all of our people, transportation issues. So we're looking at things like provider recruitment and retention. How do we get people here and how do we keep them here? But we're also looking at things like expanding telehealth access, because being in a rural region, obviously transportation's an issue, and if we can make it easier for people to see their provider, that's a win. And certainly COVID over 3 years proved that we could do that effectively and efficiently. So the coalition is looking at all of those issues and trying to put science-based initiatives into practice, but also looking at innovation. We did have an imperative to form, and that was driven by the Maryland Department of Health. So they wanted to see regional and local health improvement coalitions either started or revitalized. And the reasons are many. So few resources, it just makes sense to work together. And some of our problems are cross-cutting, right? They're affecting the hospital, they're affecting health departments, they're affecting employers. So it just makes sense to put all the heads and brains in the room together. Early on, what the coalition looked at was diabetes, and specifically pre-diabetes. 1 in 3 adults in the Mid-Shore has pre-diabetes, and that's a condition prior to diabetes, but it's preventable. So if we can get people to change their lifestyle and practice healthier habits, certainly raising awareness of the issue was a first step. So 80% of the people who have pre-diabetes don't even know it. It's really easy to find out if you're at risk. There's a number of websites you can go and take a quick 5-minute risk test. The next step is actually following up with your provider and finding out what steps to take. But for most people, if, again, we're changing our lifestyle, we're looking at how active we are, how healthy we're eating, how much we're controlling our stress, we can actually prevent diabetes by almost 60%. The good news is the CDC has a program called the National Diabetes Prevention Program. It's been around since 2010. There are hundreds of these programs across the country. And one of the goals for our region was figuring out how to connect people to those programs, reducing barriers, so offering them in person, but also online, so it can fit into a 2023 lifestyle. So all of the health departments, Choptank Community Health, and the hospital all work together to launch this program. The Eastern Shore Area Health Education Center actually delivers it, but it's a commitment. It's not a fad program. It's not like a quick weight loss program. It's a year-long commitment. And the reason it's a year is because changing your lifestyle, changing habits takes a lot of time. But you're connected with a lifestyle coach who helps walk you through making changes in your life that are manageable. And you're also with a peer group. So we worked with the clinical providers to start screening and referring their patients to the program. Before, there wasn't really a process and a system in place to do that. And so our clinical partners have a system now where they're screening their patients, and anyone who meets the criteria for pre-diabetes is referred to the Eastern Shore AHEX Diabetes Prevention Program. From there, they can either enroll in the online program, they can enroll in an in-person program, but the AHEC really acts as that hub to get people where they need to be. We're also pooling resources. We have about 5 different diabetes prevention programs right now. And instead of us all competing and promoting our own program, we've pulled resources together. So we have one marketing campaign with one regional identity. And it's been so successful working together and pooling resources that it's really set a model for all of the other work that the coalition is doing.